I understand Population Council obviously does a lot of work on family planning and reproductive rights. And so talking about what we're seeing in the US at the moment in terms of politics and executive orders, the global gag rule being reinstated and funding to UN agencies working on this being cut, what are some of the potential sort of worst case implications for this?
And I think it's safe to say that the Mexico City policy is devastating. And what we know is that the Mexico City policy has been enacted under previous administration, but what's particularly devastating about the version being put forward by the Trump administration is the magnitude of what's going to be affected. Historically, it's only focused on international family planning assistance, but the current proposal is that it should be applied to all global health assistance. And what's particularly important for people to know is that what that will see is a reduction in family planning provision, but we'll also actually see an increase in the incidence of abortion, the contrary to what the policy is trying to achieve.
And specifically, what does that mean for Population Council's work in that area?
So the Population Council worked in a number of countries around the world, and a number of our international partners, because this policy, the Mexico City policy, applies to international non-profit organisations. So our partners around the world are going to face real shortages, and we're going to see clinics cut. We're going to see people not able to access life-saving services, and ultimately we expect to see people dying as a result of not being able to receive these life-saving services.
What about the US administration's cuts to UNFPA? How are those going to play out, do you think?
So I think it's too early to tell, but I think our expectation is that they'll be devastating. UNFPA plays a unique role in global health, in global development, particularly around women and girls. And they don't just work on family planning, they work on maternal health, they work on ending female genital mutilation, on obstetric fistula. And they also provide frontline services. If you look at the work they've been doing in just the recent months amongst Syrian refugee populations in refugee camps in Jordan, they've estimated that they've provided life-saving services to over 5,000 women in pregnancy and childbirth without a single maternal death. And if you can imagine the circumstances in which doctors in those refugee camps are performing these services and the conditions that the women are living in, to have not had a single maternal death from more than 5,000 deliveries is truly remarkable. And that's what's at stake if UNFPA funding gets cut.
And obviously evidence is at the heart of Population Council's work. Tell us a little bit more about sort of why that's so important, especially now.
I think evidence is needed now for two reasons. One, because in this sort of world of ideological divides, we need to have impartial evidence around what makes a difference. But the second thing is, as resources become even more constrained, we need evidence around what works, what's proven. We want to invest in things that we know will work, that will have the biggest return on investment, that are both effective and cost effective. And we need research and evidence to really inform those policies and programs.
Research itself is quite expensive though, and has no real return on investment in financial terms.
It has a massive return on investment, and there's a tiny proportion of what's spent on programs. If you think of the millions and billions of dollars around the world spent on interventions, the amount that's spent on research is a tiny fraction of that. And if you can just prove the effectiveness of a program by just a few percent, then that more than covers for the cost of the research to deliver that program, and has many and multiplying benefits. So I would argue that it's absolutely the thing that we should be doing now more than ever, is making sure that those investments are evidence-based and evidence-informed.